Hello, welcome to Pathagonia. This is Jay. Today we are going to talk about chemistry tubes. Tubes that we see every day if you work at the hospital, but yet get confused on what each top is and why there's a particular order and how they relate to different areas of pathology. So let's begin with the difference between serum and plasma in terms of chemistry. So serum is when you collect the patient's blood, you let the blood clot, and then you remove the liquid on top of the clot. Plasma tubes have anticoagulant inside so that there is no clot. And some anticoagulants include sodium citrate, heparin, and all four of these tubes have EDTA. It's confusing for me because plasma also refers to something else in a different setting, the composition of blood. When you see those diagrams that break down blood after centrifugation, you have the red blood cells, you have the buffy coat, and then the liquid on top of it is called plasma. So that's why it's confusing, because plasma is used in two different settings. There is an order in which we draw blood because we don't want whatever's inside the tubes, the additives, to contaminate the later tubes, which can then confound the results. So we have our bacterial culture bottle, and there are different types. There's ones for aerobic and anaerobic bacteria, and then the light blue is sodium citrate, 3.2%. Citrate binds calcium, and so it is an anticoagulant, and it's actually rapidly metabolized by the liver, kidney, and to kind of tie it into the blood bank, we actually use citrate for apheresis procedures. And in fact, sometimes patients will complain of numbness or tingling around the mouths because the citrate binds the calcium, and so we'll give them calcium during their exchange procedures. And some studies that, or many of the studies that are done are coagulation studies like PT, PTT, D-dimer, fibrinogen. So let's talk about the red tops. So there are two types. This one has a serum activator, and what that means is there's either a glass or silica coated coating that activates the coagulation cascade. And then there's a red top with a yellow tube or yellow coloring on top. And that means it has a serum separator. So how does this separate serum from the red blood cells? Well, it's because this, once you centrifuge it, the red blood cells have the highest density, so it'll go to the bottom. The gel will go into the middle, and then the liquid remaining will be on top, separating the liquid remaining from the red blood cells. And this also has a clot activator. So what do we use the red tubes for? We use them for serum tests. You can use it for blood bank tests as well. Okay, green tube is heparin. So heparin inhibits thrombin. And what tests we use it for include therapeutic drug monitoring and lipid panels. And then these four all have EDTA. And EDTA it binds 10 times stronger than citrate here. So it's a much stronger anticoagulant. And in fact, kind of tying it with pathology, EDTA is a type of decalcifier we use on bone specimens that still allows us to do molecular studies after we decalcify it. And to kind of tie it in with hematology, EDTA affects the electronic interactions between neutrophils and platelets so that the platelets clump around the neutrophils, and the patients will have a spurious spurious thrombocytopenia. And the solution to that is to add sodium citrate. So what do we do with EDTA tubes? You can do a CBC, hemoglobin A1C. You can do blood bank studies, type in screens. So the pink top is generally used for blood bank studies. This tan top is used specifically for lead studies. This royal blue is for rare metal detections, not only lead but other metals as well. And then this purple can be used for your CBC, hemoglobin A1C. And then after the EDTA, we have the gray tube that has fluoride, sodium fluoride. And the reason why fluoride is important is because fluoride inhibits glycolysis. It inhibits the breakdown of glucose. So this tube, as you might expect, is used to measure a patient's glucose level in addition to lactate. So I hope you enjoyed this quick, informative video on the different tubes we use, why we have to have it in a particular order, what anticoagulants are used, the difference between serum and plasma in a chemistry setting, and some connections with pathology. All right, well, thank you. Bye.